Hi, I'm Dr. Baylor, and if you're watching this video, it means you have decided to have your tonsils taken out, and this video is to prepare you for the surgery and to hopefully answer any questions that you might have. The surgery itself is very quick. It's only a 30-minute surgery, and you will get to go home the same day. We do have to have you at the surgery center or at the hospital 2 hours prior to the surgery. That gives you time to meet the nurses, the anesthesiologist, and to make sure you have all of your questions answered and that there are no surprises. Now, the surgery itself, I always say, is the easiest part of the whole thing. It's the recovery that's the hard part. So I don't expect you to have a whole lot of pain the day of surgery. It's usually about day 2 or even day 3 that are going to be your worst days. So just be prepared that that happens and that it is a normal thing. It does not mean that anything has gone wrong. To help you out during the post-operative recovery period, I do give you some prescriptions for pain medications. I'll be giving you those the day of surgery. If you are over the age of 16, I'll be giving you 3 different prescriptions. The first one is a narcotic. It's called hydrocodone, and it also has Tylenol in it. Now, I always give this as a pill. Now, people always ask, why don't I give it as a liquid? And the answer to that is the liquid is extremely hard to find. I once had a patient go to 13 different pharmacies and could not find it anywhere. And that's very, very frustrating. The pill form is much easier to get. So what I do is have you take the pills and you can crush them. So you can get a pill crusher at the pharmacy and you can grind it up into a powder, and you can use the equivalent of up to 2 pills every 6 hours as you need it. Now, usually the people who take less seem to do better, and I never know if that's because the people who take less just have a higher threshold of pain, or it's the act of taking less somehow helps you to feel better or feel less like a patient. The second prescription is for an anti-inflammatory. Now, I can't have you taking ibuprofen because it thins your blood too much, and we don't want to put you at higher risk for bleeding. So I put you on an anti-inflammatory called Celebrex, and that one you take twice a day. It does come in a capsule. If you want to, you can break the capsule open and you can put it into some applesauce or to some liquid. Doesn't really matter what you put it into. So with the Celebrex, it is the least risk of causing a bleed of any of the anti-inflammatory medications. So I'm going to give you enough of that for 2 weeks. So you will continue taking that until either your pain goes away or you run out of the prescription. Now, I will tell you, for Celebrex, a lot of times it's hard to get that covered by your insurance, and so I recommend you use goodrx.com. If you go on that, you can do it right on your phone, and you get the prescription for Celebrex, you get the coupon for that. Your cash price will be less than $20. And again, you can do it all on your phone. If you try to go through your insurance, sometimes it will not be approved, or I've heard people saying it's over $100 for the prescription. So goodrx.com. Now, the last one that I'm going to give you is a steroid mouth rinse, and you'll take 2 teaspoons of that and you're going to put it in your mouth and let it go to the back of your throat and just let it roll around in the back of your throat for about 30 seconds, and then you can spit it out. You're going to do that every 4 hours, and that will help reduce inflammation. It's okay to swallow some of it, but I don't want you to swallow all of it. Now, as you're recovering, there are 2 main reasons why I would want you to call me. The first one would be as if you're bleeding. I do not expect you to bleed, but it happens. The most common time for it to happen is about 1 week after surgery. And the reason for that is, sometimes if you have a scab, the scab will fall off a little too early and it'll bleed underneath that. Well, the throat's a little bit the same way, in that about a week after surgery, it starts to slough off, and sometimes you will get a little bit of bleeding. Most of the time, it's not anything impressive. And so if the bleeding lasts for less than 30 minutes, there's really no need to call. If it's lasting for longer than 30 minutes, or if it's really strong, then you give us a call. We always have somebody on call 24 hours a day. The other reason to call is if you just can't drink anything. Some people their throat hurts and they don't feel like drinking. This is more of a problem with children, but even with adults, sometimes it's hard for them to get the drinks down. And so if you call up and say that all you've had is a tiny amount of water to drink for an entire day, then we're going to tell you that you can want to call, but we're going to tell you you're going to need to go to the emergency room and you're going to get IVs put in. If you get IVs put in and you get fluid in you, you're going to feel a lot better, but nobody wants to go to the ER. So we try to avoid that by making sure that you get enough liquids in by mouth. It's okay if you don't eat solid food. You can go 2 weeks without eating solid food, but you can't go more than a day without drinking liquids. Now, if you are under the age of 16, all the things that I said about the pain medications, we actually don't use those medications if you're under the age of 16. The difference would be that I would put you on a Tylenol, and you can alternate that with ibuprofen. So basically every 3 hours you can take either Tylenol or ibuprofen. You don't overlap them. But we stay away from the narcotic medications with anyone under the age of 16. Now, as far as people always ask, what foods can I eat or what foods should I try to eat after the surgery? I'm going to give you a handout on the day of surgery that kind of gives you some guidelines. They are just that, they are guidelines. Some people have told me that they ate nothing but soup for 2 weeks, and I've also had people who swear they were eating a hamburger on day 2. Now, I usually don't recommend eating a hamburger on day 2, but everyone has kind of a different recovery period. Again, I'm not so worried about what you're eating. I'm more concerned about that you are drinking enough. Don't worry, you're going to get back to all the foods that you like soon enough, but during that 2-week period, slowly progress, and like I said, you can use the guidelines that I'll be handing out to you as far as what foods maybe to start with. As far as the liquids, some things that people like are fruit smoothies. Sometimes you can get a fruit smoothie with a little bit of protein powder in it. Sometimes some people like Italian ice. Some people like frozen yogurt. Ice cream is okay, but any of the dairy ones tend to kind of gunk up in the back of the throat, and a lot of times people don't like that when their throat is healing. Really, any liquid is going to be fine as long as it is either room temperature or cold. Really don't want you doing hot liquids or anything spicy or fizzy because that's going to irritate the back of the throat. The same thing as far as hot. I don't want you taking really hot showers because that actually kind of opens up your blood vessels and then puts you at a little higher risk for bleeds. Now, remember, the night of surgery, you can't have anything to eat after midnight. You can eat all you want prior to that, but nothing to eat after midnight, and in the morning, nothing to eat, and not even water. We really need to keep everything out of your stomach. Again, you do need to be at the hospital 2 hours ahead of time. You should have already received your date for when you need to be at the hospital or the surgery center, and you should also have your post-op appointments. Now, I don't do any specific lab tests the day of surgery, other than if you are within childbearing years as a female, you will need to have a pregnancy test. The reason why I bring that up is I don't want you going directly to the bathroom as soon as you get there, because they have to have just enough to be able to do a pregnancy test on you prior to the surgery. So that's about it. You should hopefully be getting ready and getting prepared for your tonsillectomy. Again, eat up all you can ahead of time, because for about 2 weeks you're not going to be eating a lot. Most people do lose some weight for the surgery, which may or may not be good, sometimes up to 10 pounds or so. Unfortunately, most people do gain it all back, because when your throat feels better, food tastes really good. So I'll be talking to you at the pre-op to see if you have any additional questions, but hope everything goes well. We'll be talking to you soon.